Tell us a little bit more about the research that was conducted that led to Botox being approved for chronic migraine.
So there were multiple double-blind placebo-controlled trials that were done before we got to the preempt trial, 7 of them. And this has led some physicians who are not so knowledgeable in the field to be highly critical of the Botox data because those 7 trials were all negative. And so they'll point to preempt and say it's 1 out of a series of trials, and you've only got 1 positive set of trials. When in fact what was being done in these exploratory trials was working out the correct patient type. So we looked at episodic migraine, chronic daily headache, eventually getting to a population that matched with chronic migraine. And we also changed the injection paradigm. We were testing different methods of injecting along the way. So we tested doses from 25 units to up to over 250 units. So it's a broad range. And what we found is that when you went above 200 units, you got a lot more side effects, a lot of neck pain. When you went below 155 units, you didn't separate from placebo. So the design of the trial was to look at the sweet spot between too many side effects and lack of efficacy. And that was 155 units to 195 units. The FDA approved 155, but the trial design had this range in it with an option of doing 40 additional units if the patient had a headache that was worse on one side. So the design of the trial preempt is a accumulation of 10 years of work trying to determine the best sites to inject to get the optimal effect.